This video clip is about rhizotomy and how it might help your pain. Many patients have what we call spondylosis, or wear and tear arthritis of their spine. They may have had facet joint injections or medial branch blocks and been diagnosed with facet-mediated pain. Many of these patients also have just low back or neck pain. Often their pain doesn't go past their shoulder or their knees. If they indeed got great relief with a facet joint injection, but it didn't last long enough, they are candidates for something called a rhizotomy. Let me tell you a little bit about why we do rhizotomies. Oftentimes patients have that pain that's located right in the neck, and it's from these little joints that line the base of our spine. They're very much like our finger joints, so they do get arthritic over time. There is a small nerve that goes right to that specific joint. A rhizotomy procedure burns that nerve. What happens during the procedure? Well, you get to the surgery center. We numb you up, your skin up really well. We might give you a little bit of sedation just to make you comfortable. We use very careful technique in order to put that needle right along that area where that nerve will be. That nerve does nothing else other than tell your brain that that joint is hurting. And then what we do is we use sound waves to heat that little nerve up, about 5 mm burn, for about 1.5 minutes. During the procedure, what we do is we have lots of checks and balances to make sure we're not anywhere near the nerves that we don't want to be. Then you wake up, go home, take it easy that day. Recovery is usually just that day, and the next day you're back at work feeling pretty good. In about 2 weeks, we'll ask you to come in and we'll do the other side. And in about 4 weeks later, you probably have pretty good pain relief. This pain relief might last anywhere between 6 months, but hopefully it lasts a whole 2 years.